ramp up. A recent survey from Harris Poll found that 68% of Americans are worried that the worker shortage in healthcare could have an impact on their own health. Here to break it down for us is Dr. Folusho Ogunfiditimi, President and Chair of the American Academy of Physician Associates. Thank you so much for joining us this morning.
Thank you for having me.
So let's get into this. This healthcare worker shortage is not new. Tell us how it started getting worse and how it's impacting you.
Yeah, so patients are impacted significantly as it relates to having challenges with patient access to medical care. Patients are frustrated and anxious about it, and it's resulting in some challenges in our healthcare today. The recent poll that you just stated suggested that 75% of patients believe that the healthcare system is not meeting their needs. Another 25% or so are giving it a failing grade. The good news is that it is a challenge, and PAs can help to accomplish and close those gaps. Right now, it's taking about 4 weeks or so for a patient to come in and even see me in clinic, and that is simply too long to wait for health care, something that PAs can help to address.
PAs being physician's assistants that work under a physician like yourself.
So, yeah, so we collaborate with physicians, we collaborate with other healthcare providers, and the way in which we practice varies from state to state. So it's not a direct supervision in certain states, and what we're trying to do is modernize laws so that PAs can actually work to the top of their education, training, and experience more so than a direct supervision.
Let's talk about the nursing shortage as well, and also techs. A lot of people help make us healthy when we go to the hospital or to our primary care provider. What are you hearing about how nurses can get more help or maybe even ramp up their numbers in the healthcare system?
So nurses are a critical part of the healthcare team, just like PAs are. PAs are healthcare providers. We work directly with nurses. So we are more involved in terms of being able to make diagnoses, treat patients, write prescriptions in over 50 states and the U.S. territories today. We ensure that PAs are practicing to the top of their ability and top of their licensure as we help to collaborate and form the medical teams. As you will see in the survey, patients really believe that PAs can be part of the solution. Over 91% of patients state that in this survey. They believe that PAs can be a solution towards closing those healthcare gaps and increasing access to care and helping to obtain appointments.
So I know a lot of these polls go to what can the healthcare system do better for the patients, but I'm sure you can flip the script there and say, what can the patients do to help the physicians? I'm assuming it means to be more patient as patients, but what else can you give us as tips?
So one thing that patients can certainly do is to continue to help support the modernization of PA practice laws across the country. You know, talking to legislators, talking to policymakers about the challenges that they face in accessing health care. They can talk about their experiences with PAs and how PAs really reach out to them and are critical to addressing their health care needs. PAs have the opportunity to spend more time with patients and go deep into the care that they need. So by having patients as a voice, as we continue to advocate for improved practice patterns across the state, those are some of the things that patients could certainly help us with. And that's demonstrated in this Harris poll.
Dr. Ogunfiditimi, thank you so much for joining us this morning.
Thank you. And for more information, please visit aapa.org/patient experience.
Perfect. Thank you so much. Have a great weekend.